I'm Dr. Gerald Harris from Fort Worth, Texas. And we're going to be talking today about stem cells and their use for musculoskeletal pain treatment. Stem cells are currently available in the United States in three different types. The first one are called autologous stem cells, and what that means is they come from the person and go back into that same person. These are two different varieties. We can get the autologous stem cells either from fat or we can get them from bone marrow. The fat has a higher percentage of stem cells in it than does bone marrow, and the stem cells that are in the fat tend to lose less of their viability with age than do the bone marrow stem cells. So between those two, typically the better choice would be the fat stem cells or adipose stem cells. The third choice are what are called placental stem cells. And these are basically fetal stem cells that come from the placenta instead of from a baby. So this gets rid of the whole ethical problem with aborted fetuses and getting fetal stem cells. In fact, a baby has to be born in order for you to get these stem cells. The advantage of the fetal stem cells or these placental stem cells is that they're brand new. They have lost no viability with age, and when you use those types of stem cells, it cuts out half the procedure. We don't have to harvest the fat. We don't have to harvest the bone marrow either. And those are fairly painful procedures, and quite frequently after the procedures are done, the patients complain more about pain from where we extracted the fat or the bone marrow than they do where we injected it into the damaged areas of their body. The disadvantage to the placental stem cells is that you're using a DNA from another person's body. There's not been any problems shown to arise from that yet, but who knows, with future, there may be things that show up with that. The other advantage of using your own stem cells is that you don't have to worry about getting an infection, or at least not catching anything that you don't already have. However, on the other hand, these placental stem cells are very well screened ahead of time to make sure that the person has no known infections. Well, next question is, when do you use the stem cells? We have options. We can do platelet-rich plasma injections to repair it, or we can use stem cells. Typically, you would use stem cells when you have a really severe damage problem. Basically, what you want to think of is use the stem cells when something is missing. The biggest situation in which we use those are with severely deteriorated joints, where the cartilage is almost completely denuded off the bone. Well, in those cases, you really don't have much left there to salvage. If there's even a thin layer of the cartilage left, we can usually salvage it with the platelet-rich plasma. But if they're completely gone and the bone's completely denuded, then there's nothing left to salvage. And this is the case where we would use the stem cells. We inject them in there, get a thin layer of cartilage growing, and then it's just a question of how many treatments with the platelet-rich plasma we would need to finish the job. The other situation where we would use the stem cells is if you had a torn ligament or tendon that was partially retracted and you had a little gap in it, and we need to fill in that gap. Then you can inject the stem cells in there mixed with some of the platelet-rich plasma, and it will form a scaffold, and that will go in, grow across that area and fill it in. We can put the platelet-rich plasma injections in there to go ahead and finish the job and strengthen the connective tissue back up to where we want it to be. And those are the general situations where we would use stem cells.